All right, so back with Sharon, and this time we're talking about
The back of the shoulder pain.
if your shoulder hurts back here.
Back of the shoulder right here. If it hurts here, the most likely one is the scalenes. So that's the muscle between the trapezius and the sternocleidomastoid. So we're going to use this tool, and we're going to use the big end of it with the small ball. This is a big bend tool.
Yep.
So we're going to start right here.
So we're finding the area just between, in front of the trap. So your trap is your big muscle that you can grab on the
Right
back
here.
of your shoulder.
Yeah, here's our trap. It's coming up here, and then here's our sternocleidomastoid.
Yep.
And we want to be between the two of them right
in
here.
between them. So.
And then we're going to press in and towards the other side. And if you can do it while you're stretching, that's better.
Yep.
So we're trying to make these muscles longer and squish those painful chemicals out. And then we'll move down. So we're looking for the painful spots.
Yep.
So if we have a painful spot, we're going to hold it, breathe, and relax, and push those painful chemicals out, then lift up slightly after the 2 breaths and do it again. If it's not painful, keep going down until you find a painful spot.
Yeah, this
And
one
go
feels all right. And then the last spot, you're going,
towards the first rib,
which is right between your collarbone and your trap.
right there.
And you're digging down in there. And when I stretch that, that feels...
He notices that one?
Yeah, this one usually feels bad for most people. Most of the time. So it's a good
You
one to
found
get
that?
in. So it's 2 deep breaths, relax it, 2 more deep breaths. You're just trying to look for a change in that pain sensation. And then you can follow a couple different lines. So you can go down just in front of the trap. You can go down just behind the sternocleidomastoid.
That's correct.
And then you can also go down just kind of right in the middle and just exploring around there. And then you follow it up with a stretch. That's going to be helpful. So this here is just a stretch strap. I like it because you can reach through and kind of trap your hands so you don't have to grip. And then I'm going to pull my arm low using the stretch strap and then come up so I can get some opposition here as I come across. So
Re-educating it.
yeah, 3 lines of stretch. 1 is I'm going to sniff my armpit. That's going to stretch more in the back by my trap. 2, I'm going to bring my ear to my shoulder, and that's going to stretch more right in the middle. And then 3, I'm going to kind of look up a little bit as I do it, and that's going to stretch more in the front.
Perfect.
Is there anything you want to watch out for when you're digging around in your neck with
I think this is
the
good.
ball?
Yeah. So, well, don't do both sides at the same time.
do one side at the same time?
Yeah.
How come?
Well, you could possibly get the carotid artery, but if you're not used, but it's hard to treat both sides at the same
Hard
time.
to treat both sides at the same time. If you do both sides at the same time, you can create a blood choke, and now you're doing jiu-jitsu on yourself. So don't do it.
That's right.
Sit.